The items that you need to activate a new patch pump include a personal diabetes manager, or PDM, a pump base, a packaged reservoir patch, rapid-acting insulin, and alcohol wipes. We recommend that you use double-sided tape to attach the pump base to the patch. Consider using a skin barrier product or extra medical tape to enhance adhesion. Wash your hands with soap and water and wait until they dry. Open the package of the reservoir patch. Attach double-sided tape to the bottom of the pump base. Connect your pump base to the new reservoir patch. You will see 4 flashes and hear 4 beeps. Attach the pump base to the patch. The double-sided tape will keep the pump base in place when you are wearing it. Clean the top of the insulin vial with an alcohol wipe. Screw the needle tightly onto the syringe and take off the cap. Slowly pull down the plunger to draw insulin into the syringe. Gently tap the side of the syringe to make the air bubbles rise to the top. Slowly push the plunger up just enough to remove the air bubbles. Pull the syringe needle straight up from the vial. Insert the syringe needle perpendicularly into the insulin fill port on the side of the reservoir patch. Keep the syringe vertically aligned with the patch pump. Slowly pull back the plunger until it is fully retracted. This will remove the residual air from the reservoir. Release the plunger and withdraw the needle from the fill port perpendicularly. Hold the syringe with the needle up and pull back some on the plunger. Gently tap the side of the syringe to make sure the air bubbles rise to the top. Gently press on the plunger to remove air bubbles until insulin fills the needle hub and you see a drop of insulin at the tip of the needle. Reinsert the needle in the fill port perpendicularly and slowly fill the reservoir with insulin. Remove the needle from the fill port. Place the protective cap back. Safely dispose of the syringe. Before the priming starts, keep the patch pump at least 30 centimeters away from any magnetic object, such as mobile phones and magnets. Go to the main menu. Select Patch. Then select New Patch. If your patch pump has been filled with insulin, tap Next. Remember, before you start priming, make sure the top part of the button cover is pressed and locked in place. Hold the patch pump on a clean flat surface with one hand, and with the other hand press the top square part of the button cover all the way until you hear a click, indicating the needle button is locked in place by the 2 hooks on the button cover. If the top part of the button cover has been pressed and locked in place, tap Next. The priming process takes some time. Do not remove the button cover before priming is completed. Once priming is finished, this screen will appear and the pump will vibrate 3 times. Then you can continue to attach the patch pump. Now choose a flat and pinchable placement site. Clean it with an alcohol wipe and let it air dry completely. Remove the button cover. Then peel off the 2 pieces of protective liner. Attach your patch pump at the selected infusion site. Run your finger around the edge of the adhesive pad. Press the patch pump for 10 seconds. Press the needle button with one quick motion to completely insert the needle below your skin until the button locks in place. Press the patch pump for another 10 seconds. Tap Next if the needle is properly inserted and the following screen will appear. Slide to activate basal delivery. Now your new reservoir patch is activated.